And a very good morning to you. I'm Doug Hogan, Director of Public Affairs at the Cabinet for Health and Family Services. We are so happy that you've decided to spend part of your morning with us right here at the inaugural Transformers of Child Welfare Summit that's going on here in Louisville. Over the next hour to hour and a half in the opening session, you're going to hear from a number of speakers, and they're going to be outlining some of the exciting work that's going on that will eventually transform our system into the gold standard for the entire country. Now, you're also going to be challenged today as well. You're going to be challenged to take some action and to get involved and become more involved than perhaps you are right now. We want you to follow along on Twitter as well and share your comments with us. We have a couple of hashtags that we're using today. Hashtag WeAreKY and also hashtag UniteKY. And that is YOUNITEKY. Those are the two hashtags we'd like for you to use on Twitter. I have to tell you that we were just blown away by the response to this inaugural session. Take a look at the crowd. It is phenomenal. We have about 800 people here. There's folks from all different walks of life, people from the private sector in various capacities. We have lots of advocates here. We have lots of folks who are involved in work helping children. We have naturally government agencies represented. Various folks throughout the administration are here in different capacities. And then there's folks who also work in the field that touch children and who help children and their families every day. It's just a phenomenal group because this is such a huge undertaking. It does take all of us to make it happen. We want to get it happening and start it right now, and for that I'm going to toss it up to the podium where we have Christina Mora from WLKY TV News here in Louisville. She will be taking it from here, and Christina, we will share it, give it to you, and you can take off from here.
Welcome. I know a lot of us are still getting to your seats, still sitting down, but I want to welcome everyone. I know this is a very exciting day for all of us. I want to welcome everyone to the first ever Transformers of Child Welfare Summit. I know, yes. So I know a lot of people in this room, but if you haven't met me, my name is Christina Mora. You may also know me in a different world as Christina Detman. As Christina Mora, I'm a reporter at WLKY. I've been a journalist for about 12 years. But about a year and a half ago, my husband and I started fostering 2 little boys. And a few months after that, we adopted our 2 little girls from Malawi. So we have 4 kids in the span of 8 months. So I don't even know how I'm standing here right now. They're 2, 3, 5, and 5. So that is my world now, and I'm really excited to be immersed in this foster care world, and I'm very lucky to be standing here today. Today you can meet people from, thank you. Today we can meet people from every aspect of the foster care community. From inside the courtroom, to inside foster homes, to the family resource centers, to the agencies, straight to the Capitol. This is our chance to talk to each other, learn from each other, and most importantly, help children in Kentucky's foster care system. As we all know, those numbers are at a record high. 10,000 children are in a different home than what's natural to them. We have a full day today, so let's get it started. I know everyone's really excited. I'm ready to learn just like you guys. Adam Meyer was appointed Secretary of the Cabinet for Health and Family Services by Governor Bevin last year. He's also served as Deputy Chief of Staff for our governor. He is an attorney and previously served as a policy and political advisor, and he is now an advocate for our children. Please welcome Cabinet Secretary Adam Meyer.
So, wow, this turnout here is amazing. We certainly blew our estimates out of the water as far as what we were expecting. So, welcome to all of you, and hopefully nobody in the crowd is a fire marshal because it's become standing room only here. So, thank you guys. I want to thank Dr. Bendapudi and her team for agreeing to host this in this fantastic facility. She's been a tremendous asset to the university, and we're really happy with the relationship that we've been able to build with Dr. Bendapudi. So we really appreciate the passion and dedication and commitment and efforts to make things better for our kids here in the cabinet. But speaking of dedication, I want to brag a little bit on our team. You know, as many of you know, if you don't, I'm a policy wonk, so I can talk about policy all day long. But there's a lot of people here that are way more informed about these policies than I, who are going to be speaking today. And so what I would like to do is brag on our team and thank a few folks who have really helped put this together. So with policy, you know, without good policy, great policy, it's important that we have good people, and we have built a tremendous team here in the cabinet and in particular in DCBS. And so I want to start by thanking Eric Clark and his team for his leadership. They have tremendous drive, and when I say drive, I literally mean drive. Jennifer Warren, who's leading our transformation team here in the cabinet in child welfare, she drives about an hour and a half every day to Frankfort to work. Lisa Dennis, our chief of staff, and Joey Miner, who leads our service regions, they drive 2 hours back and forth each day one way. So I'm thinking about starting a support group. I also have an hour and a half drive. So we might be able to compare podcasts and different books on audiobooks. So no, but the team seriously has done a fantastic job. They're meeting every day, talking about transformational ideas, meeting with frontline staff, bringing ideas up, meeting with our leadership team on a daily basis, and it's astounding the amount of time and effort that's going into this. I'd also like to thank key staff from the Secretary's office at CHFS, Teresa Straw, our Chief of Staff, Deputy Secretary Putnam, Lori Robinson, Administrative Assistant, and Deputy Secretary Feely for helping really put this event together. This is, again, the first time we've done this, and something of this magnitude, of this size, obviously takes a lot of planning, and they've spent countless hours really planning this. I'd like to thank Chris and Lisa Johnson. They've been outstanding advocates and just a breath of fresh air. Many of you know, the Office of Faith and Community-Based Services was reinvigorated with the addition of the Johnsons, and we are really blessed that they were agreeable to moving their family here and really helping Kentucky in this space and really advocate for our kids. I'd like to thank Kentucky Youth Advocates. They've been really a partner in helping build this event out, as well as making sure that we can think about complex policy issues and how to find creative solutions to the issues that we face in this space. We owe a great deal of appreciation for our lawmakers that are here today. Several of them are joining us today, but they've been tireless advocates in making sure that we pass, for example, House Bill 1 and other comprehensive legislation that allows us to really move the ball forward in ways that we weren't able to previously. I'd like to thank the Administrative Office of the Courts, particularly Rachel Bingham, for making sure that the judiciary is well represented on today's panels and here in the crowd. I definitely want to thank our frontline staff, those who are in the trenches every single day, who are carrying out the mission to caring for our vulnerable children and protecting our vulnerable children. Without them, none of this is possible. And they've also, many of them have been able to work with us on some of the transformational ideas, so they've been really valuable in providing input to the ideas and the issues that we see and that they see that it's hard for us to see at the central office level. Whenever we have a list of thank yous, we're always going to leave people out. So please know that no matter why you're here, what perspective you are sharing in child welfare system, whatever you're representing, we sincerely appreciate the work that you're doing, the time that you put in, and the expertise that you share with our teams. Without you, none of this is possible. I want to say a thank you to the First Lady and Governor Bevin. The ability to really transform something this large takes leadership from the top, and there's no better leaders, no better advocates than the Governor and First Lady when it comes to ensuring that we can transform this system, making Kentucky the gold standard for child welfare, foster care, and adoption. We have our work cut out for us, but with leadership like this, with buy-in from stakeholders like you, anything is possible, and that's what this event's about. In closing, know this: Kentucky is thinking big about child welfare transformation. After today, we hope you will be too. So thank you all for being part of the team. At this time, I would like to introduce Governor Bevin, kind of. He has made a video. He is on an important trade mission in India and leading a large delegation on behalf of the state. But he did make a video message to talk about his vision for foster care and adoption and child welfare transformation. And so with that, I'll turn it over to the video, and then immediately following that, the First Lady will come up and make a few remarks, and I know how excited we are to hear from her. So thank you all for your time, and thank you for being here, and looking forward to spending the day with you. Thank you.
Hi, this is Kentucky Governor Matt Bevin. Welcome to the Transformers of Child Welfare Summit. I sure wish I could be there with you, although you are with people for whom this is their heart and soul. You're in good hands. You are those hands. And amongst yourselves, you are going to collaborate in ways that are going to be transformative. And again, I wish I could be a part of this initial kickoff, but so much work has happened behind the scenes. It's interesting when we talk about being transformers. This isn't some little plastic car that turns into a monster or vice versa. We're talking about truly transformational change in the lives of some of our most vulnerable. These are the children of the Commonwealth, children in our foster care system, children who need us to get this right. We are trying to transform what we now have in all of its imperfection into the gold standard in America. This will be the finest approach to foster care and adoption of any state in America. We have a long way to go on that front, but if it can be done, it will be done by those of you who are convened. Not only those of you who've been meeting, those who are meeting now, and those who are going to continue to implement this in the hours, weeks, months, and years to come. So much good has happened, but I'm excited by what's going to go on. Let's just take a quick look at some of the things that we've done even just of late. We have been listening and learning from the various stories that have been shared with us by foster families, adoptive families, the young people that are under state care right now. And they have helped us to identify programs that are working and the ones that need transformation. And so this is what has led to the signing of House Bill 1 in April of 2018. Those ideas that we got from these various sources gave direction to that legislative leadership in Frankfort and in Washington, D.C. HB 1 in Kentucky and the Family First program at the federal level are two programs that are going to make a profound difference in the lives of young people, both now and going forward. It is that very same transformative process that is continuing today as part of the summit that will inspire reforms inside and outside of government throughout the Commonwealth and beyond. And that is why we are using this term transformers. It's to refer to those gathered with us today, elected officials, government officials, judges, policymakers, and most importantly, our frontline staff and caregivers. We are all here to address these issues, the issues that affect Kentucky's children who, through no fault of their own, can no longer be raised by their own parents. Every single one of you that is watching this video, that is here at this conference, is a piece of the puzzle that is going to help us figure out how to do this or not. It's up to us. You're going to hear, after I'm done speaking here, from Secretary Adam Meyer from Health and Family Services. You're going to hear from Commissioner Eric Clark in the Department of Community-Based Services. These are two people who are responsible for the very frontline efforts that you just saw a video of that we've just been speaking to. This is what's going to make it or break it. It's the things that we are doing that are going to make all the difference. Thank you for being a part of this. You're going to hear also after them from somebody who is near and dear to my heart in a literal sense and figurative. And that's my wife, the First Lady, who has such a passion for this as the mother of our 9 children, some of whom are adopted into our family. This is very near and dear to us. You're going to be hearing from her throughout this year, as well as the others that are speaking at this conference. And from me, this is going to be topical. We are going to use this year, 2019, in Kentucky, House Bill 1, all of the legislation from the federal level, all the resources of those of you that are gathered in this room and others as well, to transform Kentucky, to make it the gold standard. And we want other states to take these ideas, to steal them, because there's no propriety here. We want this to be transformative, not just for Kentucky, but for America. It's going to start here because we need it to start here. We're going to do it together. We're going to do it with your help because we are Kentucky.
I wish you could see what I see right now. It's very intimidating and beautiful at the same time. There are a lot of you. Oh my goodness, this is great. I just want to thank you. Following Adam is kind of a tough act, but thank you all for being here and all that you do to care for our children. I especially want to thank Eric, who he and his staff, this would not be possible. I think for me personally, for the first time, I feel like it's really going to happen. The changes that I've been pushing and praying for, they're going to happen. I was telling somebody earlier that, you know, the little cartoon of the snowball with the arms and the legs sticking out, that'll be us this year. We're calling this the Year of the Child, and we have a lot of things planned, some that really exciting, and we'll talk about those later. But I just want to say that the changes that are coming are going to be transformative. So it's their top priority, the cabinet, it's their top priority. They listen to me, they put up with me, they humor me, and they listen. They truly do listen. They've been willing to look at every bit of the process and look at what works and what doesn't, and they're willing to get rid of that, the things that don't work, and they're listening to all the stakeholders to take their advice. I'd like to say thank you to our frontline staff and workers, both state and private. Your jobs are extremely difficult, and without you, we couldn't do this at all. Thank you to our caregivers, foster, adoptive, kinship, fictive, relatives, all of you. You've stepped up to care for our most vulnerable, and we are forever grateful. I'm really excited about 2019. I wish I could tell you everything that's about to happen, but I can't. We'll be traveling to all of the 9 DCBS regions this year to call on our faith and our community partners for this very important work. We'll be helping to recruit quality foster parents who can care for our children for a season. We'll be working to enlist quality adoptive parents who can take care of our children for a lifetime. And then we'll share with others how they can come alongside these caregivers and workers to provide the much needed support that they're going to, and assistance that they're going to need. Please know that we really, really do appreciate you. I'm not just saying that. I really, really appreciate everything you do for our kids. You're not alone. I'll fight for you till the death, and we'll continue to come alongside this very important work that you do. We're listening, we hear you, and we really do support you. So again, we're thankful and grateful for each one of you, and please enjoy the summit.
Thank you to the governor and to the First Lady. I agree this is a lot of people to be looking at, but it's an exciting day. And I feel like I'm in an interesting position because as a reporter, I've interviewed the Bevins a handful of times, and we've talked about the foster care system and the adoption system. But as a foster parent who's trying to adopt our 2 little boys, I also see things just like everyone else. I'm in this position just like a lot of you are. And I really do, and I'm not just saying this, I really do feel that every person I come in contact with as a foster parent, they're trying to help. They want to help you. They'll get you the help you need. They'll get you the person you need. Everyone has been so helpful. So I also believe that 2019 is going to be a really good year. Next, we will hear from DCBS Commissioner Eric Clark. Clark is an experienced government administration professional and specializes in organizational leadership, program development, public policy, project management, and advocacy. He is helping with House Bill 1, which is one of the things we'll talk about today and learn a lot about today. It's the sweeping foster care and abortion bill that we've talked a lot about that passed during the last legislative session and signed into law by our governor. Please welcome Commissioner Clark.
Well, good morning, everyone. I am fighting a cold, so if I sound like I'm talking through my nose or I start coughing, please bear with me. We will get through this. And thank you for this opportunity. You know, opening up about what I'm about ready to speak about, the word that comes to mind and is on my heart right now is overwhelming. Looking at this crowd and the challenges that we have ahead, it's overwhelming that all of you would take time out of your day to come to Louisville and be a part of this effort of transforming our child welfare system in Kentucky, which ultimately will lead to transformation across the nation. So we're overwhelmed with your support, that you care enough to take the time to come alongside of us and be here today. Our system is overwhelmed. We have a lot of challenges we need to address. I'll share some data and some things going on in the department right now to demonstrate that. But we're overwhelmed with the task ahead. But with those challenges, we're also overwhelmed with the opportunities to make a difference. So I want to thank Secretary Meyer. You're up here thanking everybody. I want to thank you. I want to thank Cabinet leadership. I want to thank the First Lady, Governor Bevin, Secretary Brinkman, our community partners, our regional staff, everyone here for coming alongside and being part of this effort. If you'll focus at the screens, I'm going to go through a PowerPoint presentation and kind of just talk through some things that we've got going on, kind of the state of our Commonwealth when it comes to child welfare in Kentucky, some of our challenges and some of the things we're working on to not just treat the symptoms of our child welfare system, but to implement a cure. And you'll see that at the very top, that we're not just looking to fix things in a Band-Aid approach, but a holistic approach to child welfare in full. And for those of you that have a medical background, Dr. Alvarado, I see you in the audience. Thank you for being here. You know that implementing cures and the healing process doesn't happen overnight. We did not reach this state that we're in overnight, and we're not going to fix it overnight. But the process has started, and we will get there. And child welfare belongs to all of us. And this is a spectrum that we put together in the department to kind of show that. And at the very center of this are our families and children. That's why we're here, to serve our families and children, improve outcomes for our families and children, and to serve them. And the programs that support them, whether that be prevention services, whether that be kinship care or relative caregiving, whether that be public foster care or private foster care, that could ultimately lead to reunification of a child going back to their biological family. Reunification is a key part of the child welfare spectrum. Adoption, if reunification isn't the best option for a child, adoption is a key part of the child welfare spectrum. Once those permanency solutions are in place, how do we support families and adoptive parents with post-adoption supports to keep that child stable in that home going forward? So when we look at child welfare, it's a continuum ranging from prevention services to post-adoption, post-permanency solutions for our children and our families. That outer band that you see on the slide is not exhaustive, but just showing some of the things that are in place already, whether it be our START program or our K-STEP program or our Friskies, how our schools engage the child welfare system. Our courts have a role in the child welfare system. The legislative branch has a role in the child welfare system. Community mental health centers, behavioral health, mental health, the faith-based community. We all have a role in child welfare. If you're looking for the Department for Community-Based Services to be the solution for child welfare, it's not going to work. And that's why we're so encouraged that you're here today, because you care enough to come alongside and be part of this solution. So as we look ahead, I think we need to stop and look at where we are right now and where we've been. Because you can't really know where you're going until you know where you've been. And the slide before you right now shows the number of kids that we currently have in our foster care system in Kentucky. Two numbers that I want to bring to your attention. One is in red, and one is in the blue box. In November, we reached the highest level that we've ever reached in the Commonwealth of Kentucky for the number of kids in our foster care system. 9,981 kids, 10,000 kids in care. And we still talk about 10,000 kids being in care, but I don't want to dismiss the progress that's already being made in that number. That as we stand in January, we're showing that for the first time in months, if you look at that line, it has been spiked for months. For 2 months in a row, we have now started to decrease the number of kids in care. We're close to 9,700 kids in care. And while I appreciate the applause, make no mistake, that's far too high. We still have a lot of work to do. But nonetheless, it is encouraging to see the data showing that something is changing. And we need to keep up our progress and our momentum to see the number of kids reduce in care. Secretary Meyer mentioned being a policy wonk. I am too. If you look at where the numbers started back in 2014 and where we are now, that's a 30% increase since 2014 on our foster care system, our child welfare system, kids in care. 30% increase. The system was overwhelmed in 2014. It remains overwhelmed now. At the same time, from 2014 and forward, our department had to sustain budget cuts. So as our kids are entering into care and more is expected from our department, we're given less. So that kind of just gives a perspective of what we're facing within the department in child welfare. This slide shows another spike and increase. This is the total number of foster homes that we have in Kentucky. You'll see that that number is now over 5,000. It takes simple math to understand that if you've got 9,700 kids in care and you only have 5,000 foster homes, we need to build on that capacity. And while you can see that number going up, and that's positive, more can be done for our families to step up and be part of the solution as well. This next slide shows how long it takes for a child to be in the child welfare system, foster care, before they're adopted. And I'll link all these data sets that I'm sharing with you right now together and bring it all home. But I want to show that regardless of if you're looking at the blue or at the red, if you're looking at both, the bottom line is it takes too long for a child to be adopted in Kentucky. It takes the average child in the foster care system 36 months to reach adoption. 3 years of a child's life, they have to be in the child welfare system in some type of placement before they find that forever home. That's too long. It's traumatic for the kid, and it's not what we stand for in Kentucky. The next slide shows, again, demonstrates another layer of how our system is currently overwhelmed. God bless our social worker. If you're a frontline social worker here today, would you please stand? God bless you in all you do. You are heroes who go out on holidays and on the weekends when we're home, living our life, and going into a crisis situation to keep a child safe. And this slide shows how overwhelmed you are. We recognize that. Statewide, an average frontline social worker averages over 30 cases that they have to work a day. That's an unrealistic expectation. It's unfair, and it's unsustainable. And it contributes to burnout. It contributes to a morale problem in the department, and it contributes to high turnover. And remember, at the center of that child welfare spectrum is a child and a family. And when you have high turnover, it's not fair to that child that every few months they have a new caseworker because we can't keep them on staff. They need a consistent caseworker and social worker in their life to build that relationship and trust to help them succeed in life. So this slide shows the average caseload for a social worker in the state, over 30. Here in Jefferson County, it's far higher. That's a statewide average. But here in Jefferson County, it's far higher than that. So, those are just some data sets showing what we're struggling with, our biggest challenges within the department when it comes to our child welfare work, which led us to a transformation project initiative. And child welfare transformation is underway. And what I'm about ready to walk through now are kind of some of the solutions and approaches we've put into place to address these issues. Back in March of this year, the Cabinet for Health and Family Services, the Department for Community-Based Services, initiated its own child welfare transformation initiative. It's under a formal project management structure. I'll have a couple slides on this here in a minute. That we initiated on our own to put our entire system on the table and look at ways to improve it and improve outcomes for our children. At the same time, the legislature was at work. And I want to thank Representative Mead and Representative Jenkins for being here today, who helped champion House Bill 1, which was comprehensive state legislation improving the foster care and adoption system in Kentucky. So the executive branch was at work, the legislative branch was at work, the judicial branch was at work because the courts played a key role in House Bill 1 as well in Kentucky. And at the same time, Congress was at work, passing transformative child welfare legislation in Washington, D.C. that's going to change child welfare across the nation, and that being the Family First Prevention Services Act. And there will be a presentation on that today, and we'll talk more about that. But we're incorporating our own work, House Bill 1, and Family First into our Child Welfare Transformation Initiative to lead the nation and answer the call of the Governor and First Lady to be the gold standard for child welfare across the nation. Thank you. So those data sets that I just showed led us in our transformation work to 3 primary goals. And if you don't get anything else out of today, know these 3 goals. Take them home with you, take them back to your communities, and find a way to rally around them. These are data-informed goals that we will track over time, but they're also broad enough to include everyone in the solution. Where do you fit in? That's the challenge I present to you. Where do you fit in coming alongside our transformation efforts in these 3 goals to be part of the solution? So as I just shared, we are close to record highs in kids in care at 9,700 kids. So goal number 1 is safely reduce the number of children entering into out-of-home care. How do we reduce the number of children in care? This is not simple math. This is not an approach where you don't bring in kids into care because it's a numbers game, but it's an approach where we look at prevention services. What do we need to put in place to put services and supports around families where they can thrive and prevent their children from being removed? It's also an approach of looking at the kids who are currently in the system for far too long? And how do we get them to the appropriate permanency solution they deserve? Because that will also reduce kids in care, whether that be reunification or adoption. If you're reducing the number of kids in care, this is simple math, you're going to start reducing caseloads, which hits that frontline worker every day. And I tell our social workers, and for the most part they've agreed, they've been called to this work to be social workers. That's what they're trained in. That's where their heart is. But given the state of where we are with our system and how overwhelmed it is, they're not really social workers. They're case managers and crisis managers. They go from crisis to crisis each day. So if we can reduce their caseloads into a more manageable operation and work for them, they can start working with families in a way that gets kids to appropriate permanency quicker. They're more of a social worker. Kids get more timeliness to permanency, which is goal number 3. Improve timeliness to appropriate permanency. The reduced number of kids in care, you should have more manageable caseloads. If you have more manageable caseloads, you have the resources and efforts and bandwidth in your workforce to then start working cases in a way where kids can be effectively placed and efficiently placed where they need to be. These goals that I just shared are not in rank order, but they all play off each other. They're all co-equal. And I'm convinced, we're convinced in the department that when you start seeing changes and improvements in one area, it's going to trickle and they're going to all start playing off each other in a holistic approach. So this is a slide I kind of just touched on earlier on our Child Welfare Transformation Initiative. I do want to share a couple bullets on here that we have 9 work groups. I'll show those on the next slide that meet continuously. We engage stakeholders. We have a stakeholder advisory group. We are monitoring performance and outcomes. This is not just meetings to be having meetings. We are tracking deliverables and making sure that timelines are being met and what we're being charged to do. And I also want to highlight one other thing, that we're creating a communications plan, internal and external, within the department. There does not need to be a disconnect between what our frontline social workers do each day out in the field, whether it be Pike County or Fulton County, and what goes on in central office in Frankfort. We all need to understand internally where we're going and what's going on. So we're going to be doing some internal communications so we can all speak from the same page. But we're also going to start looking at ways to communicate what we're doing externally. And that's where I ask you all again, what are you all willing to do right now to communicate what we're doing? What you're hearing right now? Are you willing to tweet it out? Are you willing to put it on your Facebook page? Are you willing to share and come alongside and share why you're here? What you think the solution is? Share something the department's doing. So we're looking at trying to share the vision through a communications plan as well. This next slide shows the 9 work groups that we have in place under our Child Welfare Transformation Initiative. We've got workforce supports. We got one on transitioned age youth. Those are foster youth who are aging out of the system. We've got prevention supports, permanency planning, technology solutions, etc. This next slide I could take a lot of time on. It really gets me going. We're implementing a new practice model within the Department for Community-Based Services. And it's called the Culture of Safety Model, or Collaborative Safety Model. And this was a child welfare specific model that was ultimately designed out of Tennessee that recognizes and incorporates safety science into our work. And it approaches our work through a trauma-informed lens. And we all need to recognize that child welfare is volatile work. As we mentioned earlier, our caseworkers, social workers, are entering homes at a time of crisis. And we need to appreciate the high stress that they work under each and every day. And I regret to share the reality that there are bad outcomes in child welfare. We live in a fallen world. There are bad outcomes in other professions. And what the culture of safety does is it creates an environment of how do you respond to these things when they happen. Currently, we're in an environment of blame and intimidation, and our social workers work in fear. And one of the things we know about the kids in care, number of kids in care, is social workers will remove them too soon because they don't want a bad outcome for that child on their watch. So how do we empower our social workers to overcome that fear? Because removing kids isn't always the best idea and the best for that child. So this is a practice model that looks at systems. It's done in the airline industry. It's done in the healthcare industry, that when a bad outcome occurs, we look at systems. And that's not to take accountability off the table and hold people accountable for things that, where it needs to be appropriately. But maybe there were factors that contributed to that bad outcome that we need to take in consideration and change the system rather than blaming someone publicly for that bad outcome. We believe that this is the right approach to accountability, and we're very excited to have this model coming into Kentucky. It starts with leadership training in my office, in the Secretary's office this month. So culture of safety, very excited about that, and you'll hear more about that. We're currently implementing House Bill 1. I will share that I became Commissioner of the Department for Community-Based Services on July the 5th, 2018. And since August 1 of 2018, we have filed 13 different administrative regulations complying with House Bill 1 and transforming our child welfare system. A lot of work in our regulatory space. A couple of highlights I'll share is we now removed barriers and have additional flexibility for our prevention services, which will help with our compliance with the Family First Prevention Services Act. We've implemented a putative father registry. That was a requirement of House Bill 1. We filed administrative regulations to implement that. We've done some red tape reduction. I know an issue that's near and dear to the Governor and First Lady's heart is we filed a regulation removing arbitrary limits on the number of foster children you can have in your home. We've also initiated the study groups on performance-based contracting and privatization. The performance-based contracting work group was charged with developing and submitting a report with recommendations by November 30, 2018. We met that deadline. The privatization work group will convene tomorrow and begin its work and do the same, develop a report with recommendations and submit it by July 1 of 2019. Do we have any relative or fictive kin or kinship caregivers in the room? Advocates, perhaps? I see one hand. Well, let me tell you, I saw one hand. There may have been a couple more that I missed, and I apologize. But relative caregiving, kinship care, is a big deal in the Commonwealth of Kentucky. It's a value statement on behalf of our child welfare system. It's a value statement on behalf of our families and children because we double the national average when it comes to placing children with relatives in Kentucky. I'm proud to say, as a value statement of the child welfare system, when a kid comes to our attention, that's where we go first. Is there a brother? Is there an aunt, uncle, sister, someone in that child's family that we can place that child with to keep them safe? It's less traumatic for the child, and it produces a better outcome. So our system's designed for relative and kinship caregiving. It's a value statement of our people. Our people want to take care of their own. And that's why we have approximately 96,000 kids placed with kinship caregivers right now in the Commonwealth of Kentucky. We complement each other well in what we're looking for, and the families stepping up willing to take care of their own. However, what we need to improve upon is once that placement is made with a relative or kinship caregiver, how do we support that family? And that's what we're working on in the Department for Community-Based Services. The Kinship Care Program, the cash assistance program that's been in place and under moratorium since 2013 has remained under moratorium. It would cost the department, I think, very conservative estimates, approximately $42 million to open up the Kinship Care Program. There would be a woodwork effect. We cannot project in the department the number of relatives who would come forward and want to qualify under the Kinship Care Program as it currently sits under moratorium if that moratorium was lifted. However, when you talk to relative and kinship caregivers and you ask them what they need, many of them will tell you they need help paying for child care. They need help paying for health care. They need help putting food on the table for the child. So we are starting a deliberate, methodical approach in the department of revamping our kinship care program. And on December the 13th, 2018, we filed administrative regulations to start creating some consistency and solutions for our kinship caregivers across the state, where we're going to start leveraging other federal programs. If they need child care, there's the Child Care Assistance Program. If they need health care, there's the Medicaid program. If they need help with food, we have our SNAP program. To start creating a service array that's consistent across the state and not having one region of our state treating kinship caregivers different from a different region, where we're all speaking from the same book and all kinship caregivers understand their options. There's legislative interest in this issue. There's a couple of bills out there filed on kinship care, and we're committed to working with the General Assembly on building upon kinship care. It is a value statement for our Commonwealth and something that's extremely important to us. These regulations, I do want to be very clear, these regulations that we filed in December are just a first step of several steps that we will be taking to create a sustainable kinship care program in Kentucky. It would be irresponsible to make promises and commitments for a kinship care program that we know, or we're even uncertain, that we can sustain going forward. This slide is one I'll share, and there'll be more information. Krista Thomas from Chapin Hall is here today, is going to be speaking on the Family First Prevention Services Act. I mentioned that earlier. This is the federal act that now shifts child welfare funding, if you will, away from congregate care settings and more toward prevention services. Congress now recognizes, the federal government now recognizes, we need to put more resources on the front end of the child welfare spectrum to see how we can keep kids safe in the home and prevent that removal in the first place. Family First Prevention Services Act is a big deal in Kentucky because in its wisdom, Congress gave some delayed effective dates, if you will. While they passed this act in early 2018, they are not requiring states to comply with it until October 1, I believe it's 2021. The slide says 2020, I believe it's 2021. But they provided the states the opportunity to comply as soon as October 1 of 2019. And given all of our transformation works, given the commitment of our General Assembly with House Bill 1, given the charge of our Governor and First Lady to be the national standard, We want our seat at the table, and we're going to be early implementers of the Family First Prevention Services Act. That's being a good steward with the resources we provided and the policy solutions that we've put in place. The last thing we want to do is implement House Bill 1 and our Child Welfare Initiative efforts in a silo, only to meet that October 1, 2021 federal deadline to comply with this federal act and have the federal government say you've done it all wrong and we have to start over again. So we're going to be early adopters and draw this in sooner rather than later. And my style of leadership, our style of leadership in the department, and I'm confident to say in the administration, is we're going to put our best foot forward. The federal government hasn't figured this act out yet either, but we're going to put our best proposal forward, because when we get it right, other states will be looking at how did we do this. That's setting that gold standard. And I'm not going to be afraid of the answer no. That if we put our best step forward and it's not good enough to go forward with Family First in October, the federal government says no, you can learn from that. You're still developing policy at a national level, because then you're going to know what you can't do, and you can take that feedback, realign and adjust, and still be an early implementer. So we're committed to the cause. We think it's the right approach for families and children, and it's another value statement of what we're trying to do here in Kentucky. Last, it's obvious, said it a couple times already, and I'll just finish with this, that when you take all these things that we're doing, and I don't want to say it, but I'll say it, but I think if you talk to other people who do child welfare work around the nation, you don't see this going on. You don't see legislators and the First Lady and a executive cabinet secretary and the governor and 800 people in a room rallying around child welfare at this moment in time. But it's happening here. So we're positioned to do great things right now. It's an unprecedented, unique opportunity to be a national leader. We're thankful for our national consultants who have come alongside. That doesn't get highlighted a lot, but people who work in this space across the nation have recognized what we're doing here in Kentucky. They're talking about it. Chapin Hall, Casey Family Programs, Annie E. Casey, Public Consulting Group, and many others here in the audience today. These last 3 bullets I'll share. Our work is going to be transparent. We don't have anything to hide. It's all on the table. We're going to be open. We're going to be honest. We may not always agree, but we're going to know where we're coming from. We're going to be collaborative. We want your partnership, and we need to develop a relationship with you. If you're a state worker, not just DCBS, but any state worker, would you raise your hand? Those of you who don't have your hand raised right now, keep your hands raised, please, sorry. Stretch time. Take notice who's around you. Go up and introduce yourself. Tell them who you're with. Tell them what you do. And ask that state worker who has their hand up what they do. Thank you. Thank you. But it's about relationships. That's the nature of social work. We can't do this work without proper relationships. So we want to be relational. And the one thing that I'll say about this work, it may not go as fast. We're working as fast and as hard as we can in the department. But we want to be thoughtful about it. Because and I'll speak just very personally as Eric Clark right now, the last thing I want as Commissioner of the Department for Community-Based Services is to see something go into place, only not to sustain itself. Things change. They can be improved, but that doesn't mean they can't be sustained. So the things that we're doing, we want a lasting, long-term, sustainable approach to what we're doing. All right. Yes. Thank you all again so much. I'm honored. We're honored in the department to have you all come alongside. I know we have people here who's worked in the Department for Community-Based Services for decades. And I know that they have never seen the tremendous pouring of support and care that they're seeing here today. So thank you all again for being here, and it's a pleasure to serve you in the Department for Community-Based Services.
Thank you, Commissioner Clark, for that look at our landscape of Kentucky's child welfare system. I have a couple of things to mention before I introduce our next speaker. If you are a state foster care parent, you are asked to go to Coat Check today at some point and sign in for your training hours. And also, the commissioner mentioned if you want to share about why you're here today, you can do so on social media. The cabinet is asking, if you look at all your papers that you have on your table, you can use a couple of hashtags, WeAreKY and hashtag UniteKY, and that way people can see what we're doing here today. So we've heard from a lot of different aspects of foster care so far. Now let's go to hearing from a judge. Judge Tara Haggerty has served as a family court judge in Jefferson County since January of 2015. Her jurisdiction includes cases regarding domestic violence, child abuse and neglect, paternity and child support, divorce, and child custody. For years, her work has included advocating for children in the Commonwealth. Please welcome Judge Haggerty.
Good morning. I'm here representing the judges, but also the administrative office of the courts. I feel a little bit overwhelmed, not by the number of people who are here. That's really exciting, but I feel overwhelmed because I've never felt so hopeful about. I feel a little bit emotional about what we're doing. It seems like it's the perfect convergence of a national focus with the money that's being made available, the governor and the first lady and the legislature, as well as the cabinet leadership. I've worked in this system for before I became a judge, I was working in the system for over 20 years, including being legal counsel for the cabinet for a time. And this focus is just so exciting for the judges. We don't look at data or numbers. I mean, AOC does, and they provide us with that, and they train us with that. We look at faces, and we hear voices, and we see the parents, and we see the children, and we see the foster parents, and it's heartbreaking a lot of times. And it's heartbreaking to not have the resources that you need. And it's heartbreaking to see the social workers who are just literally breaking under the workload that they have. So the idea, everything that Secretary Meyer and Commissioner Clark have talked about is so inspiring, and it's so exciting about what we can do. AOC has given me a couple of talking points to sort of illustrate how AOC and the judges are working with the cabinet and their efforts. There's a lot that we could do better too, and we acknowledge that. And I think we're all in this together. We are fully on board with participating, collaborating, supporting in any way that we can. AOC is giving us monthly data reports on our children in care in each of our family court divisions. I get a monthly report now about how many children I put into foster care. And I get time frames as to when I have to have hearings in order to adhere to the guidelines that are now in place with House Bill 1. AOC has been included in including judges with House Bill 1 work groups and study groups. The courts are participating in the transformation work groups that Commissioner Clark mentioned. The courts are also working to spread awareness to caregivers and foster parents about their access to court proceedings. Foster parents do quite often come to hearings when I have kids in care. They're welcome. And really, they're the ones who can tell me the most about how the children are doing and what the children need and what kind of interaction they're having with the parents. It's beneficial for me in making decisions, but it's their right as the caregiver of the child. So we're trying to make everybody more aware of that to make sure they're invited and know that they're more than welcome to attend. We are working with work groups with DCBS on the Family First Prevention Services Act, which I just think is an incredible opportunity. So I know you're here to work. I wish I could stay. I have my dependency docket today, so obviously I don't want to delay that by postponing the cases. But I really wish I could stay because I'm so excited about what you're doing and what you're going to accomplish today. I really just want to say on behalf of AOC, thank you to everybody, the governor, the first lady, the legislature, all of you, not just for this and this effort, but for what you do every day. It's important, and it's important that you feel acknowledged. We really do appreciate you and all that you do. So thank you for having me, and good luck today.
Now we are excited to introduce some of our legislators. These men and women are passionate about child welfare, just like I'm sure all of us in this room. They have been tremendous supporters of this transformation that's taking place right now. Our distinguished panelists are Senator Ralph Alvarado from the 28th District in Clark County, Senator Julie Rocky Adams from the 36th Senate District in Jefferson County, Representative Kim Moser from the 64th House District in Kenton County, Representative Joni Jenkins from the 44th District in Jefferson County, and Representative David Mead from the 80th District in Lincoln County. Please welcome them all.
All right, well, welcome, welcome. I guess I'll start off. I don't know, maybe it's because I'm the bossiest one up here. I don't think I am, but yeah. But no, I'm really thrilled to be here and to be invited and to kind of help kick this off. As everyone said, I mean, I'm not going to say anything new, but the number of people here is ridiculous. And I, for one, just want to say, thank you for what you do. I mean, in order to make any of this work, you have to have all the different components working together. You have to have the executive branch, the legislative branch, the judicial branch, the advocates, the educators. And so having everybody in this room has a really good energy. And so I'm glad to be part of that good energy. You know, I always say if I'm going to wake up and spend my day, I want to spend it doing something meaningful. And every single one of you all in this room does something very meaningful and very critical to those kids in Kentucky. You are here to make those kids' lives even better, and I thank you for that. As the Senate Chair of the Child Welfare and Oversight Committee, which was the committee that was established as a result of House Bill 1, I'm here to tell you that that is like a living, breathing committee. And if any of you all want to if you have any great ideas about topics that we can cover in that committee in a public setting, explore any new options, please, please, please bring us those, because we have our eyes open and our ears open, and we love to hear from you. So again, I look forward to a really great day and to getting lots of work done and moving the ball forward for Kentucky kids.
Well, good morning. I've got a bit of a cold as well, so please forgive me if I hack or do anything here. As I said, the doctors, when you examine your patients, you wind up picking up what they wind up having most of the time. So really exciting to be here, tremendous crowd. You all are the first line advocates for kids. As a pediatrician, I know how tough it is. I rely on our social workers a lot of times when we have kids with positive drug screens, and a lot of the issues that we have ahead of us, as we know, is the reason why those graphs that you saw that Commissioner Clark put up there is the drug problem we have in our state, and the efforts that we have to make as an entire state, as a community, to help curb that and improve those things. But please know, I think the one message I want to make sure that everybody in this room understands, you watch a lot of the rhetoric, a lot of the things you see in public commentary about politics in Frankfort. This effort in particular is a bipartisan effort. It's a global effort. Everyone's engaged. Everyone's on top of it. Everybody knows that something needs to be done. And when you're in your office and you think that no one's listening, and that you think that no one's paying attention, no one's heard your voice, I want to assure you, ignore what you see in the media, ignore that. Know that there's a group of us that hear you, that know that your efforts and your voices are being heard. We know that you are the voices of our children and the future of this state. So please continue to advocate, continue to make your voices heard to us. We encourage you to come to Frankfort and talk to your legislators. They do listen. They want to see this problem get better. We want to see our kids get better to the point where we won't have to place any kids, that our families are healthy and we can keep people in their homes. Thank you all for being here today. I encourage you, please be strong advocates, speak up for our kids. Thank you.
Good morning. Thank you all for being here. It is, gosh, I didn't look out at this big crowd when I sat down, but thank you all for being here. My name is Joni Jenkins. I represent the 44th District, which is a little to the south and west of here, so I probably had the quickest trip here this morning. I was part of the child welfare and foster care work group that culminated in House Bill 1, and I can tell you, working with Speaker Pro Tem Mead was a great, great experience, and we got to hear your voices from so many different groups. We heard from social workers, we heard from foster parents, but what I carry with me was the voices of kids in foster care. And one young woman that met with Speaker Pro Tem Mead and I was exiting foster care, and she had been in the custody of her grandmother and was taken from her grandmother and put into foster care. And she said, "You took me from a situation that I didn't think was neglectful or abusive, and you put me into a system where I felt abused." That resonates in my mind every time we talk about changes, that we are dealing with real people. And the decision to take a child from their parents, it's a huge, huge decision. And we are making that, our social workers are making that on a daily basis. So there's always a balance in what we do. Respecting the rights, and the right of biological parents is a huge right here. And when we make the decision that that child is not safe, that's a huge decision that we're asking social workers and our court systems to make on a daily basis. And we need to keep that in mind as we do what is right for children. There are nothing happens to a child in a vacuum. What happens to them at school, what happens to them in their homes, what happens to them in the community, we all need to be real cognizant of what that's going on. And so I look forward as we go forward in working with the cabinet and the great work that they're doing, that we make sure that every voice is heard as we navigate the system. Thank you so much for the work you do every single day. I just can't imagine what it's like to get up every morning and know you don't know what you're going to see that day, but you do it so well, and we thank you so much.
Well, good morning. I am Kim Mosier. I am the new chair of the Health and Family Services Cabinet, and I brought some notes because I've got a few things that I just wanted to let you know about that we are working on this session. And I probably had the longest journey today. I was stuck in Chicago last night, so I flew in this morning and into CVG. So I'm glad that things are running a little behind so I could be here with you. So thank you very much for the opportunity to be here with you. This is tremendous. I love seeing this outpouring of support and interest and genuine concern for the kids of the Commonwealth of Kentucky. I really enjoy working with my fellow legislators in a very bipartisan way. These are nonpartisan issues, which is exciting to me. And it just really is so critical that we all work on these together. And then, of course, the governor and the first lady, thank you very much for all the support that you have really given all of us in making this a priority. And, of course, working with the cabinet, Secretary Meyer and Commissioner Clark and all in the cabinet, this really, the overriding theme really is collaboration, so it's exciting. With the passage of House Bill 1 last session, we really did set in motion some issues that, or some solutions that were identified in the Foster Care and Adoption Task Force, and we're already seeing a very positive effect of less kids going into our foster care system and really addressing those underlying causes through some of these positive policy changes. We had a $28 million increase in funding that is directly impacting, we hope, the social workers who are on the front line and are dealing with families. And this is really allowing all of you who are working with families to work with them, to reach them earlier in the process and to really make a difference, again, in addressing these underlying causes of issues that, you know, really affect the children and the overall child welfare in our state. The well-known devastating effects of addiction across our state, the highest in the nation rates of incarceration, overdoses and deaths due to opioids, and the increasing rate of neonatal abstinence is affecting all of our families, and all of these contribute to the problems that we're seeing in our children. The number of Kentucky babies born dependent to opioids went from 46 in 2001 to 1,115 in 2016, and this number's rising. So one of the things that House Bill 1 identified was neonatal abstinence and as a form of child abuse. And I have to be honest, I had a little, it just gave me pause at first, because understanding addiction, we know that a lot of times the babies who are born to these women, the women are really trapped in a cycle. And so I understand the reason why we did this, and it's really to get women into treatment, and that's really what this does. So it requires that women enroll in a drug treatment program or risk losing their child. And, you know, this is, it is a positive step in that we're getting women into treatment early. This is treatment that they need and they deserve, and hopefully it's during pregnancy. This will reduce risk to newborns and to children, and addresses hopefully some of these potential long-term developmental outcomes that we're just beginning to see with neonatal abstinence syndrome. And, you know, of course, the goal is to stabilize the family in the long run. So, you know, we're looking at these evidence-based treatments and these wraparound supports, which really are so necessary in providing long-term stability to the families. Again, NAS has been identified legislatively in a lot of different pieces of legislation in the last few years, and we'll continue to work on those issues. As was mentioned earlier, fictive care and kinship care, those are some legislative issues that we're going to be dealing with. And of course, the goal is to heal the family, but ensure the safety of our children. So in keeping with my passion to address some of these issues as a former neonatal intensive care and nurse and drug policy director, I'll keep working and looking at ways to strengthen treatment, for individuals with a substance use disorder. This is such a high priority. House Bill 121 is one of those issues that will lift prior authorization requirements, which are insurance and Medicaid mandates for individuals who are seeking treatment with medication for addiction treatment. And so this will allow individuals who are ready for treatment to get treatment right then and there, not have to wait because of some arbitrary insurance or Medicaid rules that tell them that they need to wait. This will save lives. It will reduce relapse and even recidivism in the criminal justice system. Speaking of criminal justice reforms, I believe that some of these reforms will allow justice-involved individuals to get into help. These are incarcerated individuals, or hopefully we reach people before they're justice involved in some sort of pre-arrest diversion program or treatment during jail, possibly as a condition of their sentence. These are all things that we can work on, and I think it's really important. And I think we are making a difference in attitudes. I think that we're really beginning to understand all of these issues and the way they affect our family. Switching gears a little bit, I'm going to run really long. We are looking at the recommendations of the school safety work group, and these also include identifying kids, looking at at-risk kids, at-risk situations, and reaching them with the mental health care that they may possibly need, and this is a priority with Senate Bill 1 this year. School-based health centers and increasing access to school nurses and social workers in schools are all topics of discussion as funding becomes available. And we'll just keep working on that because I do think that that's very important. Another issue that Senator Alvarado and I are working on are the tobacco-free school zones. In addressing overall child welfare, I think it's important to look at our smoking rates in Kentucky and protecting those kids and our future generations. In closing, the Health and Family Services Committee is committed to working with the Child Welfare Oversight and Advisory Committee, all of the stakeholders here. And as Senator Rocky Adams said, please, please come to us when you have an idea, when you see a problem, a glaring barrier, something that we need to address, please bring that to us. By addressing mental health and addiction, we are addressing child welfare. This will be a high priority in Health and Family Services for the foreseeable future. We in the legislature, as you can see, have really embraced the charge to improve child welfare. We have accomplished many things. There's a lot of work to be done, but we are committed to working together to make a positive difference in the lives of future generations. Thank you all, and have a positive meeting.
All I can say is, wow, it is amazing to see the love, actually, that is in this room. That's the way I look at it. I will do my best to be as brief as possible. I know that you don't want to sit around all morning and listen to a bunch of politicians. I'm in politics, and I don't want to sit around and listen to a bunch of politicians all day. But the First Lady mentioned earlier that she was intimidated to speak, and I just don't believe that. As you can see, she commands the podium when she stands up to speak. Now, the first time she spoke at the inauguration, I thought, she might be a little intimidated. But today, it's a whole lot different. And I can tell you that when she walks in our offices at the Capitol, we stand at attention, and there is nothing else you can do but just get on board, because she's going to get whatever she wants. But as I said, I'll try to be brief. I just get excited about this because I'm passionate about it. I'll tell you my story real quick. My daughter was adopted from Korea. The reason we chose to go internationally is because we were fearful of the domestic adoption process. And so we chose to do that and go to Korea to adopt her. But as we did that, she was fostered prior to her coming into our adoption. And I saw the importance of a loving foster family in her life. It helped her to transition into the life that she has today. And it was important to have that process, and they've got a good process there in Korea. And that helped with her development. And as she came into our lives, I can assure you that prior to us even knowing her, she had already touched our lives. And there was a love for her before we ever even met her, because that's just the love that is just fostered in this adoption process. But I want to say thank you to all of you for what you do every day for our children in this state, because they are our most valuable resource. And I'm going to summarize just a few things that we've done over the past year. Last year, of course, was an extraordinarily successful year for us in the General Assembly, for Kentucky in general, because of the things that were passed. Not only was House Bill 1 passed, but we gave more money and more resources to Health and Family Services for the social workers. We gave raises. We gave more resources to them as far as the technology that is being used, and we're going to transform more of that technology as we go forward. But we also, on top of the $28 million that we gave to hire those social workers, we also gave $23 million more to allocate for foster placement because of the stricter timelines that were mandated in House Bill 1. We also had House Bill 527 that passed, and that kind of fell under the radar, but that was a bill that said that we were going to limit the amount of times that a child could be moved from school to school, because it hurts them when we move them so many times into placement, they fall behind. So we're trying to put the child first in that. We added family court judges in some districts where the caseloads are so overwhelming that those judges were falling way behind. One of those was in my district. My judge had the highest caseload in the state at more than 3 to 1. Now that we have another judge there, we are quickly moving through those dockets, and things are going to be better in that district. But we need to do that across the state. And so we've given a charge to the judicial system to start looking at how we can revamp the family court system and get those dockets moving faster. We put public forums in our regional foster care review boards. This is an extremely important part of House Bill 1 last year, because that data is coming back from those who are out there getting to listen directly to those foster parents. So that has been an extremely helpful piece of that bill. And last week they came into my office and sat down with me and brought recommendations to me as from what they're seeing in those areas. We also established, as Senator Adams had mentioned, the Child Welfare Oversight and Advisory Committee. This was a committee that was long overdue in the General Assembly to focus on nothing but child welfare. We know that Health and Family Services focuses on that as well, but they are just so overwhelmed with their docket that we needed this there. And since we have implemented that, it has paid dividends for us as we are getting more recommendations going forward for this year. But you guys need to be proud of what you're doing, because Kentucky is getting national attention. We had an article in a paper in Florida here a while back that I saw that mentioned House Bill 1 and the things that the legislature was doing here, but also that the things that Health and Family Services were doing and that our workers were doing to make this the best child welfare system in the nation. I got a call from a legislator from North Carolina who wanted to use some of this as a model for their state as they started transforming their child welfare system. And 2 weeks ago, West Virginia, in their media, they had some stories about Kentucky and how we had started transforming our child welfare system. And they wanted to do the same thing and use us as a model and go even further than what we had in order to create a better system in their state. So you're getting national attention. And this is what it looks like when government is operating on all cylinders. Because when was the last time that you can recall that we had a unified effort among government to do something like this? The legislative branch working with the executive branch, working with AOC. Health and Family Services was involved in all the conversations. Many of you were involved in the conversations as we went through this. Everybody working together for one common good, Democrats and Republicans alike. Most folks may not know Joni is on the opposite side of the aisle than I am, but you couldn't tell that as we did this process, because that's the way government's supposed to work, and that's the way that we need to handle things more in the future if we're going to make Kentucky the best state that we possibly can. But real quickly, as we move forward, some of the things that we want to do, we are committed, as Commissioner Clark said, to reinstating some type of kinship care program. It will not be one that is just a financial substitute for families. We are going to do more than that. We are going to implement programs, as he said. There may be some cash assistance in that, but it won't be the full amount that we've been giving before, because we can't just give money. We need to make sure that these families are getting exactly what they need. So we need to implement more programs. We also need to look as we go through this revamp of our system on how we're going to offer more programs to families to prevent their children from having to come out of their homes. And as we passed House Bill 1, one of the things that we want to do is make sure that we get those children back to their families as quick as possible, if it's safe to do so, And if it's not, then we need to move them on to that Loving Forever family that is going to adopt them and take care of them. School safety has already been mentioned, is one of our priorities, actually is the top priority for both chambers, the House and the Senate this year. We're going to make some more tweaks to the child welfare in our state because the Child Welfare Oversight Advisory Committee has come with some recommendations. Also, the Cabinet has come with some recommendations. We're going to make some changes to what we did in House Bill 1. Just like any major reform, there's always going to have to be tweaks, so we're going to do that. I've also filed House Bill 158 this year, which is the Cabinet that came. We spoke with each other and formed a bill that conforms us to the 2018 Family First Prevention Services Act. What we're going to do is we're going to require case reviews for court approval 60 days after a child has been placed in a qualified residential facility. There's going to be additional background checks. I know that folks don't like this as well, but there's going to be some additional background checks for those child placing agencies and child care facilities, because that is part of that act that requires us to come in. It requires us to come in line. We're going to tighten up some definitions coming out of House Bill 1. We're also going to make some tweaks to the putative father registry. But one of the things I'm very proud of in this bill that we're going to do, I don't actually think it's a requirement, but it's something that is needed and something that is going to give our children more of a voice, is we're going to establish a foster child bill of rights. There are also some other things that I'm going to address in another bill that will be coming soon. I'll be filing that. But as always, we are committed to the children and the families of this state. That's where we stand, and that's the first thing that we need to do, is make that a priority, because folks don't realize that from this system stems all of our society problems. The problems that we're having in our families and children being taken, it's causing a downward spiral. They're getting into a lifestyle that they can't get out of, and it's up to us to try to make a difference and get them out of that. Because when they do that, it affects our workforce. It affects everything in our state and our economy. So this is a very important piece of our entire state government, and we need to make sure that we put our families and our children first, because they are our future. So I'll close with this. I just want to say thank you again for what you've done, because you are truly changing lives. You have the most precious asset that we have in our state in your hands, and that's our children. And I believe that two of the greatest qualities a leader can have is kindness and compassion, and I ask that you serve that way, with kindness and compassion, as you go in and you look at these foster families, you look at these birth families, you look at these foster children. And as you hold them in your hands, just remember that you have the ability to change their lives. You have the ability to make their futures better. And I know that each and every one of you has the heart to do that, or else you wouldn't be doing it today. But we thank you for what you do. If we can be an asset to you, please come and see us. If there's anything that you want us to look at, if there's any opinions you may have, or some things that we need to know, data that we need to know, please come and see us at any time. But thank you all so much for what you do, and I look forward to working with you in the future.
Thank you so much from our legislators. As a foster parent, sometimes I have to remind myself that this is not about me. This is about the child. So a lot of times we can get caught up in stuff that's going on with their case and specifics, and I have to check myself and say, nope, my opinion on this needs to be set aside, and we need to deal with what's best for the child. And it's encouraging to see hundreds of people in this room who are working to make tangible changes to do what's best for the children.